Hello everyone, I am Dr. Renita Priya Souza, Associate Professor 2 and HOD, Child Health Nursing Department, Yenepoya Nursing College. Today I am going to discuss about Kangaroo Mothercare, and the contents of this presentation are specific learning objectives, meanings of Kangaroo Mothercare, key components of Kangaroo Mothercare, origin of KMC, benefits of KMC, eligibility criteria for KMC, prerequisites and process of Kangaroo Mothercare. The specific learning objectives are: at the end of the session, you will be able to understand the concept of Kangaroo Mothercare, identify the key components of Kangaroo Mothercare, enlist the benefits of Kangaroo Mothercare, describe the eligibility criteria for Kangaroo Mothercare, list the prerequisites for Kangaroo Mothercare, explain the procedure of Kangaroo Mothercare, and describe the monitoring of baby during Kangaroo Mothercare. Before we dive into the topic, let's have a look at low birth weight babies. Globally, 20 million low birth weight babies are born each year, and the prevalence in India is around 17%. They contribute substantially to a high rate of neonatal morbidity and mortality, causing a burden for health and social systems. This burden can be reduced with the support of the family at very minimal cost. Kangaroo Mothercare is such a natural form of cost-effective care given to the low birth weight babies. What is Kangaroo Mothercare? It is a simple method that includes early and prolonged skin-to-skin contact with the mother or a substitute caregiver, along with the exclusive and frequent breastfeeding. It resembles how a baby kangaroo looks when it crawls into the mother's pouch. Hence, the name Kangaroo Mothercare is given to this concept. What makes Kangaroo Mothercare so special? Kangaroo Mothercare is a natural form of human care that stabilizes the body temperature, promotes breastfeeding, it prevents infection and other morbidities in baby, it leads early discharge of babies, better neurodevelopment, and it encourages bonding between mother and infants. So from where does the Kangaroo Mothercare originated? Kangaroo Mothercare was first presented by Ray and Martinez in Bogota, Colombia in 1970s. It was developed as an alternative measure to fight the challenges of incubator shortages for babies who had already overcome initial problems but required only feeding and growth. There were lot of shortage of incubator, there were lot of low birth weight babies, but incubators were short. So instead of these incubators, this concept was developed. Research studies have shown that KMC is not only an alternative to incubator, but it is more than that. So what are the key components of Kangaroo Mothercare? The major two components of Kangaroo Mothercare are skin-to-skin contact and exclusive breastfeeding. What does KMC do? Kangaroo Mothercare satisfies all 5 senses of the infant. The infant feels the mother's warmth through the skin-to-skin contact, which satisfies the sense of touch. Baby is able to listen to mother's voice and heartbeat, so it can satisfy the sense of hearing. Baby is able to suck breast milk, satisfying the sense of taste. Baby is able to maintain eye contact with the mother, so it can satisfy the sense of vision, and baby also can smell the odor of his or her mother, so it satisfies the sense of olfaction. Benefits of KMC are skin-to-skin contact, where it promotes breast milk production and helps babies to learn to suck. It provides thermal control, it maintains baby's temperature in normal range, and also it prevents hypothermia. These babies, those who have underwent KMC, can have early discharge compared to the babies those who have not received it. And it also helps in developing emotional bonding between the mother and the baby. What is the eligibility criteria for a baby to have Kangaroo Mothercare? If the birth weight of the baby is more than 1800 grams, the Kangaroo Mothercare can be started immediately after the birth. Suppose baby's birth weight is between 1200 to 1799 grams, the baby has to be hemodynamically stable before we start the kangaroo mother care. So it may take a few days. And if suppose baby's birth weight is less than 1200 grams, these babies may require specialized care because they may have other associated comorbidities and sickness. So which has to be treated first, then baby can be given kangaroo mother care. So it may take few weeks before we initiate the kangaroo mother care. A point to note, even though all the babies, those who are low birth weight, may require the kangaroo mother care, and because this burden is huge on the healthcare facilities, priority must be given to the babies those who are weighing less than 2000 grams. What are the prerequisites of KMC? The prerequisites of kangaroo mother care are willingness of the mother. Mother should be willing to provide kangaroo mother care. She should be fully available to provide care. Her general health should be good, and she should be able to be close to the baby. That is, if suppose she is getting discharged also, she should be able to return to the baby when baby is ready to receive the KMC. The family should be supportive, and also the family and the baby should receive, or in the hospital also should receive support from the community. What are the key situations where we have to avoid or delay the kangaroo mother care? Here, if suppose baby is unstable and baby's condition is not good, we can delay the kangaroo mother care. If suppose baby has to undergo frequent invasive procedures, in such case also we have to delay the kangaroo mother care. And suppose baby has severe infections or mother is ill, mother is not able to provide kangaroo mother care, in such case we have to avoid or delay the kangaroo mother care. And also suppose baby is significantly premature, in those babies also we have to delay the kangaroo mother care. When to start kangaroo mother care? When a small baby is born, complications can be expected. The more preterm the baby is, or the more the baby is small for gestational age, the more frequent problems they will face. Provide initial care for infants with complications as per national or institutional guidelines, and delay the KMC until the baby's condition will become stable, or until the baby's condition will be improved. Deciding exactly when to begin kangaroo mother care must be judged individually based on baby's condition, or when the baby is ready for receiving the KMC, or also depends on the mother's condition as well. Initiating kangaroo mother care. Short KMC sessions can be given during the recovery period when baby still requires medical treatment like IV fluids or low concentration of additional oxygen. For continuous KMC, however, baby's condition should be stable. The baby must be breathing spontaneously without any additional oxygen to receive the continuous kangaroo mother care. The ability to feed, that is to suck and swallow, is not an essential criteria to initiate the kangaroo mother care. Even if the baby is receiving tube feeding, orogastric feeding or NG feeding, the baby can have the KMC. What should baby wear when receiving kangaroo mother care? The baby should be dressed up in a cap, socks, diaper and a front open sleeveless shirt. The shirt can be made of a soft natural fabric like cotton. The hat and socks helps the baby to keep warm. What should mother wear? The mother can wear any front open light dress as per local culture like blouse and sari, gown, maxi or front open tops. The procedure of KMC, that is positioning, kangaroo positioning. Place the baby between mother's breast in an upright position as shown in the picture. Head turned to one side and slightly extended. Hips are flexed and abducted in a frog position along with arms flexed. Baby's abdomen should touch the mother's epigastrium, and mother can support the baby by supporting at the bottom, and baby can be secured with a binder. How mother can provide kangaroo mother care while sleeping and resting? Reclined or semi-recumbent position achieved with adjustable bed if available. If not, it can be achieved with providing several pillows to the mother at the head end. This position may decrease the risk of apnea for the baby. If mother prefers sleeping on her sides in a semi-reclined bed, if the baby is secured, there will not be risk of smothering. A comfortable chair with adjustable back may be useful for resting during the daytime. A reclining chair can be used if suppose she wants to provide kangaroo mother care when she is sitting. What is the length of KMC? How long it can be provided? Start skin to skin contact gradually with smooth transition from conventional care to continuous kangaroo mother care. Avoid sessions less than 60 minutes because frequent changes can be stressful for the baby. Gradually increase the duration and provide continuously during day and night. We can interrupt kangaroo mother care only during change of diapers or maybe during mother's routines. Suppose mother has not able to provide care for a long time, another family member, maybe a father or maybe grandparents also can provide the kangaroo care to the baby. But if it is not possible, then keep the baby wrapped up and keep it warm on a cot covered with the blankets. Duration. How long KMC can be given? If both the mother and baby are comfortable, continue as long as possible, first at the institution, then it can be continued at home. Continue until the baby reaches term or achieves 2500 gram of weight. If the baby is uncomfortable, baby is fussy and pulling limbs, then slowly wean from KMC. It can be continued during cold nights. How the baby should be monitored during kangaroo mother care? What all things we need to monitor? First thing is temperature. We have to see that baby's temperature is in the normal range and baby is not hypothermic. Observe breathing and well-being of the baby. Monitor growth and weight of the baby. Head circumference should be measured weekly and provide stimulation to the baby by gently patting the baby or singing to the baby or talking to the baby. When the baby can be discharged? If the baby's general health is good, there is no concurrent disease such as apnea or infection, and if the baby is feeding well, and also baby's weight gain is appropriate, that is at least 15 gram per kg per day for at least 3 consecutive days. And if the baby's temperature is stable in the kangaroo mother care position, that is within normal range for at least 3 consecutive days, and if the mother is confident in caring for the baby and able to come regularly for follow-up visits, then the baby can be discharged. How kangaroo mother care can be provided at home and what are the routine follow-ups to be followed? Confirm continuation of kangaroo mother care at home if needed. Ensure follow-up for the mother and baby, that is 2 follow-up visits per week until 37 weeks of post-menstrual age, or 1 follow-up visit per week after 37 weeks. So let's conclude the topic. Kangaroo mother care is a safe and effective method for caring stable low birth weight babies. In addition to providing thermal control, it promotes exclusive breastfeeding, decreases the risk of infections and promotes bonding between mother and the baby. To summarize, in this session, we have discussed about what is kangaroo mother care, how it has to be provided, who is eligible for the kangaroo mother care process, and also what baby has to wear, what mother has to wear, how it can be provided for 24 hours, what is the duration, what is the length, and how we have to monitor the baby during the kangaroo mother care. Thank you.